So we are going to discuss one important topics. There is cardiac failure, congestive cardiac failure. Now, cardiac failure, what is the purpose of the heart? This is very important. What is the purpose of the heart? Purpose of the heart is to supply blood to the tissues for metabolic demands. For metabolic demands. It may be extraction of oxygen, it may be removal of carbon dioxide, it may be adequate nutrition to the tissues, adequate removal of wastage from the tissues. So for metabolic demands, we need the supply of the blood to the tissues. And this supply is given by heart. From the right side of the heart, right ventricle, blood goes to the lungs. So pulmonary area is supplied by the right ventricle and the tissues, other systemic circulation is given by the left ventricle. So if there is any failure of adequate amount of blood supply, or the blood supply is there till there is inadequate amount of oxygen and other things to the tissues, even after effort by the heart, it will be defined as heart failure. Is it clear to you? So, failure to supply the adequate metabolic demand of the tissues by the heart is defined as the cardiac failure. And you can determine what are the factors which may be involved in cardiac failure by simply understanding one important formula. The heart failure, total heart failure, everything can be understood by one important formula, that is cardiac output is equal to stroke volume into heart rate. This is the important formula. Cardiac output is equal to stroke volume into heart rate. If you remember this formula, you can determine everything in relation to the cardiac failure. Because it is the failure either in two factors, either in the stroke volume, that is amount of blood ejected in each systole, or the heart rate, that is contraction of the heart per minute. These two factors determines what will be the cardiac output. Is it clear? Now, stroke volume means the amount of blood ejected in each systole, that is contraction of the heart, stroke volume. From the left side, the blood goes to the systemic circulation and the right side to the pulmonary circulation. Now, what are the factors which may determine that the stroke volume is reduced or stroke volume is not able to maintain the enough cardiac output to supply the demand of the tissues? What are the factors? Stroke volume is reduced, or stroke volume is there increased, but it cannot maintain the adequate supply or demand of the metabolic demands of the tissues. It fails to maintain that. I think it is very easy why the stroke volume is reduced. Stroke volume is reduced. Heart is pumping blood in the eye. Heart is contraction, and during each contraction there is ejection of the blood. Tell me one factor where there is reduced stroke volume.
Heart muscle weakness.
Very good. I am telling you, very good. The weakness of the heart muscle. Very important. So if there is weakness of the heart muscles, either due to myopathy is some pathological condition of the heart. Usually it is congenital in nature, that is congenital myopathy. Or if there is myocarditis. Myocarditis means viral myocarditis. You know there are some viruses which involve the heart and lead rise to viral myocarditis, the inflammation of the muscles of the heart. In that case, there will be weakness of the cardiac muscle and fails to eject the blood. Is it clear to you? So this is a very important discussion, is myocarditis or cardiomyopathy. It may be say rheumatic myocarditis, a rheumatic fever with carditis, previously discussed. In that case also, as there is a myocarditis occurs in rheumatic fever with carditis, in some cases of that there will be failure of the heart. We know that. So, cardiac muscular failure is very important. So this is very important. The stroke volume is reduced. One of the important cause. If you are asked, tell me 2 or 3 important causes of the heart failure. You can easily utter from this simple formula. From this simple formula, that is cardiac output stroke into heart rate. So if the stroke volume is reduced, output will be reduced. Right? So stroke volume is reduced in one condition. They say involvement of the muscle. Involvement of the muscle may be either due to myocarditis, viral infection, or due to, it may be some say cardiomyopathy, that is from congenital origin, from birth there is weakness, and you know there are different types of cardiomyopathy in medicine, right? There is a restrictive cardiomyopathy, while there is a obstructive cardiomyopathy and dilated cardiomyopathy. In restrictive cardiomyopathy, which is more found in Kerala and other sites, these cases incidence are high. There is endocardium of the heart is thickened. So much so, there is less place in the heart. Less place in the heart for return of the blood. Capacity of the heart is reduced. And definitely stroke volume will be reduced. In obstructive cardiomyopathy, there is obstruction of the flow. Definitely stroke volume will be reduced. And dilated cardiomyopathy means the heart is so weak that it is dilated and appropriate contraction is not there. So in cardiomyopathy, myocarditis and rheumatic failure with carditis, with cardiac failure, you will see the weakness of the myocardium. So I think there should be another answer from another bench. From this bench, you tell me second important cause, there is weakness, they say, second important cause, the stroke volume is reduced. বলো কিছু চিন্তা করার কিছু যা মনে হয় বলো হেভি এক্সারসাইজটা না দাঁড়াও আসছে ওটা দ্যাট ইজ অলসো ওয়ান ইম্পর্টেন্ট কজ দেখো না জিম করতে করতে অনেকে মারা যায় এক্সেসিভ জিম করছে মারা যায় সেটা আমি পরে ডিসকাস করবো তার আগে সহজ খোঁজ দু একটা বললে ভালো স্ট্রোক ভলিউম যে তোমার তার হ্যাঁ atherosclerosis তো হবে না বড় very good and this is the answer stenosis see if there is a aortic stenosis or the pulmonary stenosis do you think the adequate cardiac output will be there হবে না তো so in case of increase after load it means the load is after heart is contracting there is 2 types of load in the heart one is preload means diastolic filling of the heart preload means diastolic preload means diastolic filling of the heart that's before the contraction load is the amount of blood so during diastole sufficient amount of blood which is coming that's called preload in the heart afterload means where there is resistance of the blood flow heart is contracting properly but there is resistance so increase afterload good answer তুমি দিয়েছো good answer is afterload what is the afterload কোথায় কোথায় problem হলো afterload হবে if there is a aortic stenosis if there is a pulmonary stenosis ছেড়ে দাও হতেই পারে লাংসে systemic circulation যায় after aortic stenosis if there is coarctation of the aorta severe or if there is systemic hypertension তাই না if there is systemic hypertension that can give rise to afterload reduction increase afterload and cardiac output is less is it clear so severe aortic stenosis severe coarctation of the aorta severe hypertension can give rise to cardiac failure ঠিক আছে now go to the another case tell me another causes of stroke volume is reduced হ্যাঁ কি বলছো বসুন so this is also good explanation let us discuss this preload so preload we should discuss regurgitation means blood is coming from the left atrium to the mitral regurgitation left atrium to the left ventricle similarly in tricuspid regurgitation right atrium to right ventricle or if there is aortic regurgitation, means aorta to left ventricle, or pulmonary regurgitation from pulmonary to right ventricle. Okay. So in all these conditions, also in conditions of congenital heart disease like ventricular septal defect (VSD), the blood is going from the left side of the heart to the pulmonary circulation via right ventricle, and then from pulmonary circulation to the left atrium and left ventricle. So there is actually load on the left ventricle, increased preload. And similarly, in case of patent ductus arteriosus, where the blood from the aorta is going to the pulmonary circulation, again coming back to the left atrium and left ventricle. It is severe PDA, so preload is huge increased. When the preload is huge increased, it can do it easily up to a certain limit. If you stretch the cardiac muscle will contract with more force, but that is up to a certain limit. That is called Starling law. Frank Starling law. Okay? But that should be a limit. When the limit is crossed, what will happen? Heart will fail. Heart will fail. Heart cannot pump the blood. So here his answer is very good. It means it is related to the preload, and there is also failure of the heart, but the mechanism is like this. Okay? Let us go to the other condition. Who can tell the other causes of heart failure?
Sir, the walls of the heart are fibrosed.
সে তো বলেছি রেস্ট্রিক্টিভ কার্ডিওমায়োপ্যাথি বললাম তো হতে পারে সেটা ওটা একটু পরের ব্যাপার। আচ্ছা ইন কেস অফ ওটা তো তোমার কার্ডিওমায়োপ্যাথির মধ্যে পড়ে গেল। ছেড়ে দাও, ওইটা ও যেটা বলেছে দ্যাট ইজ অলসো গুড অ্যান্সার। Late bundle branch block, LBB, that is usually occurs in ischemic heart disease. So that is also good answer. But I like the answer from the other benches, not from the same bench. So ischemic heart disease also. But in pediatric ischemic heart disease, is it common? It is not common, but it may occur. For example, suppose the coronary artery usually takes origin from the aorta. Now, suppose there is some abnormal condition where the coronary takes origin from the pulmonary artery. তাকে বলে anomalous origin of coronary artery from pulmonary artery. বুঝা গেল? Anomalous origin of coronary artery from pulmonary artery. L-kappa. So in L-kappa conditions, there may be ischemia of the heart, and there is chances of heart failure. We have seen the cases of L-kappa. Operation done and cases survived. This is anomalous origin of coronary artery from pulmonary artery. So ischemic heart disease, that is correct answer. In ischemic heart disease, there may be left bundle branch block. Right bundle branch block is not so much severe. It is very common in present in normal persons also, but LBB is dangerous. And the heart, left heart fails, everything fails. So that is good example. Go to the other benches. তোমাদের বেঞ্চ কিছু একটা বলো, হাতটা ফেল করে যাচ্ছে, কেন ফেল করছে বলো। হ্যাঁ, very good, very good. Here so much, if there is a pericardial effusion or constrictive pericarditis, it can give rise to less amount of filling of the heart. তাই তো? If there is constrictive pericarditis or cardiac tamponade, say, huge amount of effusion compressing the heart, and there is less amount of blood is coming to the heart. Morning in those. So that can give rise to dystonia. So it may so happen that in case of say, severe cardiac pericarditis, constrictive pericarditis, or effusion compressing cardiac tamponade can give rise to heart failure. Now tell me the another causes from that bench. We may pass on from intrinsic, say, stroke volume to heart rate. We can go to there, heart rate. What are the possible causes, other possible causes where the heart rate is contributing to the heart failure? Let us explain what is happening. If the heart rate is increased, the cardiac cycle time is decreased. But the systolic time is fixed. It is at the compromise of diastolic time. So when the heart rate is very much increased, the diastolic time is reduced, there will be less amount of blood is coming to the left ventricle, also both ventricles, yes. So in case of increased heart rate, the amount of blood entered in diastole, and payload is more. So what will happen? If that contracts, that amount of blood is going there, but it is not sufficient enough to meet the metabolic demands of the tissues. That is the definition of heart failure. It is the cardiac output is such that it cannot maintain the metabolic demand of the body systems. So in case of increased heart rate, that may happen. Let's tell me what are the important causes of increased heart rate which can give rise to heart failure. তোমাদের বেঞ্চটা একটা তুমি তো বলেছো তারপরে বেঞ্চে যাও তোমার পিছনের বেঞ্চ বলো tell me one condition the heart rate may be increased and there will be failure আরে ব্যাডিকার্ডিয়া ব্যাডিকার্ডিয়াতে হার্ট রেট কি বাড়বে কি কোনটা বললি ব্যাডিকার্ডিয়া ট্যাকিকার্ডিয়া কি বললে হার্ট রেট বাড়বে কিসে তা বলো সেটা জোরে বলো so it is cardiac arrhythmia and especially bradycardia may happen for example say complete heart block that may give rise to failure also complete heart block total so that can give rise that is also one good answer but tachycardia is more appropriate answer for your choice complete heart block may occur in newborn and others in case of say mother is suffering from SLE systemic lupus erythematosus and there may be baby is born with the complete heart block. It cannot maintain the metabolic demand of the baby. Heart rate say 40, 30, 40 runs. So that can give rise to that. That is also one of the important cause of the heart failure. But before that you should take tachyarrhythmia, cardiac arrhythmia. Right? That can give rise to heart failure. Answer is correct. Go to the other benches. কতটা পর্যন্ত হলো তারপরে তোমাদের তো হয়ে গেছে বলো conditions where there is used severe tachycardia giving rise to heart failure it is also a good answer the coronary artery disease that is also a good answer remember this should be included in the intrinsic cardiac intrinsic stroke volume that will reduce stroke volume. We have seen nowadays very large number of cases of Kawasaki disease, where there is a coronary abnormality will be there, and that abnormal coronary dilatation can give rise to blocking of the coronary artery, and that can give rise to ischemia of the heart with failure that may occur. Okay, so your answer is also correct. A Kawasaki coronary disease can give rise to heart failure, but that is not related to the tachycardia. Tachycardia should be other important causes of tachycardia that can give rise to heart failure. Next bench, tachycardia. Jure, exercise. Now let us take another example, severe anemia. Severe anemia, thalassemia is a severe anemia. That can give rise to heart failure. Anemia can give rise to heart failure. Exercise is a good thing. So better not to mention exercise. I mean, you do not do exercise, there are chances of heart failure. So that should not be. This should not be the message. So, severe anemia can give rise to heart failure. The reason is very clear to you. There is severe tachycardia. Diastolic feeling is very less. That can give rise to heart failure. So, next you go to the what are the other causes? If there is infection. Infective endocarditis, infection in the heart. Infection is there, so there is less chance of say heart contraction will be disturbed particularly. আর কিছু হ্যাঁ pancreatitis তো বলেছো একটু আগে ডিসকাশন হয়েছে now any other causes অ্যারিথমিয়া বলেছে একটু তো অ্যারিথমিয়ার মধ্যেই পড়ে যাচ্ছে অ্যারিথমিয়া কার্ডিয়াক অ্যারিথমিয়া বলেছেন। So these are the common important causes of heart failure. Thyrotoxicosis, you should not forget, though in pediatrics it is not very common, it occurs in the adult, but we are getting cases of thyrotoxicosis, where we say heart rate is increased and that can give rise to tachycardia and sometimes heart failure may be there. There are lots of other conditions where you will get this type of say reduction, say increased heart rate, giving rise to less cardiac output. We will discuss these things in the later slides. All the slides are there which will demonstrate all these things. Let us go to another important question. Concept is that, so you see the cardiac output may be decreased in three important conditions. One is abnormalities related to the preload. That is structural heart disease, BSD, PDA, etc. Or say some congenital cyanotic heart disease, if adequate management is not done, say TGA, transmural gate arteries. Right? Allostetrology usually does not present with failure, right? But rarely it may give rise to failure, but that is due to other cases, say anemia, infection, etc. So, transposition of the gate arteries or say single ventricle, etc. The cyanotic heart disease are there. Also, acyanotic heart disease like BSD, PDA. So, structural heart disease can give rise to alteration of the circulation that can alter the preloads. Preload means say diastolic load in the heart, and there may be chances of failure. Second important things we learn is the intrinsic heart failure, where the myocardium itself is not able to contract, giving adequate blood supply to the body. And third one we have discussed the afterload. It means there is some resistance, either systemic hypertension or some obstruction is there. So there is less amount of blood is flowing to the circulation, afterload. Okay? So these are the three important conditions of heart failure. And there are two important other conditions is that the more cardiac, say heart rate is there, output is there, not supplying adequate blood. Thalassemia, severe. The hemoglobin is reduced so much that it is not carrying the adequate amount of oxygen, right, to the tissues. So high output is there, but there is not adequate supply. That is also failure as per the definition. There is called high output failure. And in afterload failure is the low output failure, and the output is low due to obstruction of the blood flow. Okay, so these are the different terminology. We should not remember all this terminology. But if anybody asks you what are the causes of high output failure, it means you can give this the example of tachycardia, severe thalassemia, etc. So let us go to the causes. These are the causes in the slides. You see the almost all causes are, I think, discussed, but these are one important cause. You see we have discussed the acidosis and ischemia, that is also important cause. Acidosis means cyanotic heart disease giving rise to more formation of lactic acid that can give rise to that. And another important case is hypoxia heart failure due to respiratory disease. Secondary to respiratory disease, severe bronchiolitis, severe pneumonia, there is hypoxia that can give rise to heart failure. I think these things are clear to you as a causes of heart failure. This is a cardiac preload that is already discussed, and you know all these things. I think you answered these cases, and your answers are noted here. Okay? So increased preload. Cardiac afterloading means obstruction. So afterload is reduced. Miscellaneous factors. Severe anemia, expansion is there. So thalassemia, the expansion is there. Why there is failure in thalassemia? Why there is failure in thyrotoxicosis? Increased heart rate and diastolic filling is reduced. I think it is very easy to remember. Now, infection, discuss already. If there is any capacity, it can take away the capacity of the myocardium for contraction. Cardiac arrhythmia, that is also discussed. It can give rise to heart failure. Ischemia, he said that cardiac ischemia and alcohol discussed can give rise to heart failure. Metabolic abnormality, if there is anything, suppose glycogen storage disease, a Pompe's disease, heart failure may occur. Okay. So if there is other metabolic heart disease that can stress on the heart, give rise to heart failure also. So what are the physiological changes in the heart failure? So let us go to your common sense first slide. This is the, here you can discuss all these things. If the volume of the blood is less, going to the tissue is less, volume of the blood is going to the kidney is less, সবাই তো বলে ফেলেছে আবার প্রথম থেকে শুরু করি তোদের থেকে শুরু করি ঠিক আছে if the volume of the blood is going to the tissue is less, suppose the volume of the blood going to kidney is less, what metabolic, what physiological changes you can expect from that? তুই তো বলেছিস আগে তুই বলছো বলো বলো রাশ মেকানিজম বলো না রাশ মেকানিজম পরে যখন তুমি প্রফেসর হবে তখন বলবে বলো পুরো নামটা বলো রেনিন অ্যাঞ্জিওটেনসিন অ্যালডোস্টেরন সিস্টেম সেই সিস্টেমটা অ্যাক্টিভেট হবে তো যদি রেনিন অ্যাঞ্জিওটেনসিন যদি অ্যাক্টিভেট হয় রেনিন যদি তোমার বেশি বেরোয় তাহলে অ্যাঞ্জিওটেনসিন হবে অ্যাঞ্জিওটেনসিন কী হবে বলো এই অ্যাঞ্জিওটেনসিন 1 থেকে কী হবে 2 হবে তা 2 হলে কী করে ভেসোকনস্ট্রিকশন সো ইট উইল ইনক্রিজ দ্য আফটার লোড ঠিক আছে এই একটা মেকানিজম হয়ে গেল আর একটা হচ্ছে অ্যালডোস্টেরনও বেশি সিক্রিশন হবে রেনিন অ্যাঞ্জিওটেনসিন অ্যালডোস্টেরন সিস্টেম সো অ্যালডোস্টেরন বেশি সিক্রিশন হবে if there is more aldosterone secreted there will be more retention of salt and water and there will be more congestion because of the cardiac failure there will be congestion because heart is not pumping properly there will be congestion everywhere ঠিক আছে lungs congestion tissue congestion and at the same time there is aldosterone increased aldosterone can also give rise to congestion salt and water retention so this is the heart failure compensation what is the compensatory mechanism you heart failure compensatory mechanism তুমি বলেছো কি আগে তাহলে বলো তুমি বলো compensatory কি করবে হার্টটা initially it will try to save the main important organ brain হ্যাঁ কিডনি লিভার এগুলোকে বাঁচাতে চেষ্টা করবে হ্যাঁ দ্যাট ইজ অলসো সে কী করবে না সোডিয়ামটাকে বার করে দিয়েছে so there will be increased level of the natriuretic polypeptides হ্যাঁ ঠিক আছে natriuretic polypeptides গুলো বাড়তে শুরু করবে সিক্রিশন ব্লাডে সেকেন্ড ইম্পর্টেন্ট থিং রিডাইভার্সন অফ দ্য ব্লাড টু আদার প্লেসেস অন্য জায়গায় যেগুলো ব্রেনে বেশি ব্লাড দিতে হবে সেখানে চলে যাবে আদার টিস্যুস মে সাফার ফ্রম lack of blood supply ultimately if all this system fails then the heart will fail so heart failure may be compensated sometimes it is compensated and sometimes it is decompensated or you are not getting only a way to relieve sometimes the patient with the shock cold coming extremities so much blood supply that's called cardiogenic shock so let us discuss the mechanism of this so the same thing is discussed here same thing there is angiotensin and aldosterone mechanisms RAS system same thing okay kidney effect on heart now suppose sometimes we get our aim is to in a case of structural heart disease where the heart disease is there our aim is to keep at this status that is there should be no hypoperfusion and there should be no congestion our aim is that is compensated cardiac status this is our aim heart is weak heart failure is there because of the structure of BSD or PDS severe with drug and other things our aim is to keep at this status first status right second status heart failure is that no hypoperfusion, that is, blood is going to the tissues, but with congestion. Congestion is there. That is, blood is going to the tissues, but oxygen in the blood is so low, there is congestion, but still it is not efficient to supply the adequate demand. Okay? So, this is called, as the perfusion is there, blood is going there, so it is warm, and congestion is there, wait time. So, warm and wait time. Next important thing is the dangerous time. Here the blood is going less, also no congestion, cold and dry type. একে তো ব্লাড যাচ্ছে না, তারপর আবার ব্লাড একটু বেশি গেলে যদিও আবার টিস্যু বের করতে পারতো কিছু, এখানে সেটাও হচ্ছে না। দিস ইজ ডেঞ্জারাস টাইপ, cold and dry type. And last one is that tissue, lungs, hypoperfusion, congestion, cold and hypoperfusion, cold and wait time. Cold means cold coming activities. Capillary refill time more than 3 seconds, cold coming activity, sweating, etc. These are the hypoperfusion status. Now, clinical features is expected, what is expected, that is written there. What you have discussed so long, that is also there. In case of neonates, the features is non-specific features. Tachycardia, tachypnea, failure to poor feeding, weight gain, edematous condition, these are neonatal features. And fetal heart failure is fetal arrhythmia. You will see the causes are, say, RH incompatibility severe and Epstein anomaly, severe type of Epstein anomaly. Epstein anomaly is a condition where the tricuspid valve is not attached at the normal position. It is attached below the level of its normal position. As a result, the right ventricular capacity is very low. That is called Epstein anomaly. It may be very severe, and child usually, if not taken adequate care, may die at the neonatal period. Or it may be mild type also, where the child may live up to a certain age, and then it needs operative correction. Epstein anomaly. So, what are the infant? What may happen in a case of heart failure? Definitely, the heart will try to eject the blood. Tachycardia will be there. Respiratory difficulty will be there. Tachypnea will be there, and because of the increased sympathetic secretion, there will be sweating. There will profuse sweating will be there because of increased sympathetic secretion, and poor feeding. As the failure, child is having difficulty. So child is sucking breast milk, and after sucking, say, few seconds, the child is facing difficulty for taking the breast milk. So child will try to take rest and then suck again. So that is called suck, rest, suck cycle. Commonly used by the postgraduate students when you ask them what is the features of heart failure, they'll first tell you, sad, suck, rest, suck cycle. So this is important thing that you should remember this, because this means there is poor feeding, and that is baby is trying to take some rest, have to rest for that. There may be less weight gain, definitely, it's like tissue is not getting enough supply. Periorbital puffiness. In the infant, you will not get the dependent edema. You will not get the dependent edema. Can anybody tell me any explanation why in infant heart failure you may not get the dependent edema? So, normally if there is failure of the heart, if the person is older children, dependent edema means edema of the leg, or if the child is lying, then edema of the sacral region. But the infant, it is not possible, because infant is crying, and mother will take the infant because of the crying in different position. কখনো এইভাবে নিচ্ছে, কখনো এইভাবে বসাচ্ছে, কখনো কাঁধে ফেলছে. So what is happening? The position of the baby is constantly changing, but one position you cannot change. That is the face. That's why the facial puffiness is an important sign of the heart failure in in pain. And definitely there will be chest capitation will be there, enlarged liver will be there, cardiomegaly with features of heart disease, if it is present, you will get it, and gallop breathing, the third sound also. Very difficult to hear the gallop breathing during the time of the failure because chest is full of capitation and baby is suffering from severe respiratory distress. Very difficult to get the rhythm, but if you are very good clinician, you can get it. Now, in older children, you see these are the symptoms of heart failure. There is exertional dyspnea, easy fatigability, orthopnea, বুঝে পড়ছে, paroxysmal nocturnal dyspnea. Here I have discussed dependent edema, and you will get the features of rheumatic heart disease. Older children, you get the features of rheumatic heart disease. It is present there. Okay, and say congenital heart disease also may be there. Eisenmenger complex or syndrome, you know that can give rise to also failure, and cardiomyopathy, myocarditis, or secondary to respiratory illness. All these factors you have discussed in the very beginning. What are the causes? You can get all these features. This is also discussed again. What are the features of heart failure? Remember the heart rate, tachycardia, tachypnea, enlarged liver, chest full of capitations. And in older children, you can get neck vein engorged in the case of heart failure. Okay, and this is the common, and cardiomegaly obviously will be there. This is the criteria how to assess the severity of the heart failure. NYAHA, New York Heart Association, for adult, it is the modification of that, the Ross modification, but Ross classification of the heart failure. You see the grade 1, grade 2, grade 1 is no difficulty, grade 2 during feeding mild difficulty, and moderate difficulty during feeding or insertion grade 3, and severe difficulty as rest also grade 4. Investigations in a case of heart failure, this is a very, you must do the chest X-ray PIU. I think you should answer all these things. I should not teach in the class because you know already what are the investigations you should do in a case of heart case. Bolo. Tumi ekta bolo. Very good. Chest X-ray. You will get the cardiomegaly. Means cardiac, you know the cardiomegaly, that is transverse diameter, the heart, how put by total chest ratio, more than 50% or 55%. No, একটা করো, তুমি একটা বলেছো, that's sufficient. So chest X-ray, cardiomegaly you will get in chest X-ray. Second investigation? ECG, yes, good. ECG, important thing. Third, echocardiography, determine the level of lesions and other things. Fourth, একটু বলো। হ্যাঁ, আর কি ইনভেস্টিগেশন করতে হলো? হ্যাঁ, ওই তো বলেছে, তারপরটা বলো। MRI করতে হবে। This is a recent investigation. Also, hesitate যা মনে আসছে বলে দাও। MRI you can do, and MRI nowadays is very important investigation, supine regulations. তুমি একটু বলো। Catheterization prior to operation, usually not done routinely, but prior to operation or intervention, cardiac catheterization is required for finding the structure of the coronary. Suppose you are going to operate the tetralogy of Fallot, and in about 10 to 20% cases, the coronary is taking origin from the abnormal site. So before operation, you will have to do cardiac catheterization to find out where the coronary is taking origin. So that is important practical. That is also important investigation for management of the surgical management for cardiac catheterization. It's not the routine investigation. Next, তুমি একটা বলো, ওর তো বলেছে কাছে তুমি, হ্যাঁ, for next investigation, yes, biopsy. It is needed in case of say myocarditis, particularly giant cell myocarditis giving rise to heart failure, myocarditis giving rise to heart failure, or in case of say endocardial fibrinostosis, etc. For myocarditis diagnosis, endomyocardial biopsy is important for confirmation. Suppose myocarditis with failure, you treat the patient is improved. After that, you will have to do that. Very good answer. So, this should be investigation. What are the next investigation? Bolo? quick. CBC, complete blood count. So hemoglobin concentration and other important things. Electrolytes is very important. Sodium, potassium, calcium, this is magnesium, etc. These are very important investigations to find out that. And as there is less amount of blood supply to other areas, liver, kidney, etc. So that you should do liver function and kidney function test. And natriuretic peptide level that will be increased, that should be determined. And say CPK level, troponin 1 and troponin 2 levels, the acute myocarditis, they are increased, so they should be, they are important observation. And lastly, the thyroid function test to assess thyroid toxicosis. If you get the features of that, or simply by routine investigation, you can do that. So what should the treatment of cardiac failure? একটা ওই দিক থেকে যায়, দিকটা তো হয়ে গেল, তাই না? ট্রিটমেন্ট অফ দ্য হার্ট ফেলিওর, তোমাদের বেঞ্চে তোমরা একটা বলো, হ্যাঁ হ্যাঁ কোনটা? না, যাকে বলবে সেটা আমি যে তুই ঠিক করবি নাকি? বলো ট্রিটমেন্ট। না ডায়াবেটিস কেন? আরে প্রিলিমিনারি জিনিসটা দেখো, যদি অ্যানিমিয়া থাকে তাহলে অ্যানিমিয়ার ট্রিটমেন্ট করবে, যদি ইনফেকশন থাকে ইনফেকশনের ট্রিটমেন্ট করবে, তাই না? যদি তোমার ফ্লুইড কম থাকে তাকে ফ্লুইড একটু দিতে হবে, কিন্তু বুঝে সুঝে। কার্ডিয়াক ফেলিওর পেশেন্ট নিডস অনলি 60% of the requirement. You should not go above 60%. এই শোন না বাবা, বইয়েতে বিশাল লেখা রে, এই লেখা শুনে সুবিধা হবে, জলের মতো করে পড়ানো হচ্ছে, শুনে যে বইটা খুলবি তাহলে হয়ে যায়। বলো নেক্সট। সো ইউ শুড ডু অল দিস থিংস লাইক দ্য অ্যানিমিয়া, ইনফেকশন এক্সেট্রা করতে হবে। যদি কোনো স্ট্রাকচারাল ডিজিজ থাকে তাহলে তার কারেক্টিভ সার্জারি করতে হবে আফটার ম্যানেজমেন্ট অফ দ্য ফেলিওর। And nutrition support, oxygen and fluid and salt restriction, that is important. Next, go to the things. বলো, ও তো বলেছে ডায়াবেটিস, তুমি বলো, তুমি একটা বলো ট্রিটমেন্ট। প্রিলিমিনারিটাও বলেছে, তুমি একটা বলো। না, ডায়াবেটিক্স, দ্যাট ইজ ইম্পর্টেন্ট, ভেরি ইম্পর্টেন্ট ডায়াবেটিক্স। ফুরোসেমাইড ডায়াবেটিস তোমাকে দিতে হবে, তাই তো? কারণ ডায়াবেটিসে কনজেশন কমানোর জন্য ডায়াবেটিস থাকে। হোয়ার দ্যার ইজ কনজেশন, উই নিড ডায়াবেটিক্স, তাই তো? So where there is congestion in any tissues, lungs congestion or systemic congestion, you should give liberally diuretics and furosemide is the drug of choice. And so furosemide should be given, but as furosemide is causing the potassium loss, some bodies add spironolactone, some bodies add another things. I am going to that. Okay. So diuretics accepted. Ionotropic agent. বলো তোমাদের বেশ, তুমি বলো, তোমরা বলো। হ্যাঁ, আয়োনোট্রপিক যেটা কার্ডিয়াক ফোর্সটা বাড়াবে, ফোর্স অফ কন্ট্রাকশন বাড়াবে। ইন কেস অফ কার্ডিয়াক ফেলিওর, ফোর্স অফ কন্ট্রাকশন ইনক্রিজ করতে হবে। কি করে ফোর্স অফ কন্ট্রাকশন ইনক্রিজ করবে? আগে তো আমাদের সময় ডিজকশন খুব ইউজ হতো, উই ইউজুয়ালি ইউজ ডিজকশন। এখন ডিজকশনটা ইউজটা কমে গেছে, বুঝতে পেরেছো? বাট টিল সামবডি ডিজকশন, সাম বডিজ, সাম রেকমেন্ডেশন ইজ দেয়ার, ইউ ক্যান গিভ ডিজকশন, বাট ডু নট গিভ দ্য লোডিং ডোজ অফ ডিজকশন অ্যাজ গিভেন বিফোর। ইউ শুড অ্যাভয়েড দ্য লোডিং ডোজ ইন কেস অফ চিলড্রেন। লোডিং ডোজটা দিও না। ডিজকশন ইজ সামবডি ইউজ, বাট এছাড়া তো আরও পরে, এগুলো পরের দিকে, শেষের দিকে, কার্ডিয়াক শকেতে, ঠিক আছে? সো ফর আয়োনোট্রপিক অ্যাকশন ইউ ক্যান দিস, আর অলসো দ্যার আর আদার ড্রাগস, ওরা যেটা বলতে চাইছে একটু বলেই দিচ্ছি। ইউ ক্যান গিভ ডোপামিন, ইউ ক্যান গিভ দোবুটামিন, ইউ ক্যান গিভ ডোবুটামিন, ডোপামিন, অ্যান্ড গিভ দি norepinephrine and epinephrine, etc. as an ionotropic drugs. Okay, so that depends on the condition. Next, you go to the afterload reducing agent. Afterload, yes. AC inhibitor is most important. পড়ে ফেলেছিস তো, সব দেখছি। তো এসি ইনহিবিটর দিতে হবে, তাই না? হ্যাঁ, তো মনে রাখবে যে এসি ইনহিবিটর যখন তুমি দেবে, there is some retention of potassium. So that's why spironolactone is less, and what usually done is the furosemide and AC inhibitor to make it compensated cardiac failure. Okay? Usually if you follow the prescription, you will give the furosemide and AC inhibitor. Previously, AC inhibitor like captopril are not used in and others, but now it is recommended. Now it is recommended. So diuretics is furosemide. Ionotropic drugs that is discussed. There are two important aminotenol, middle, they are not available always, and very strong drug. Last drug. Afterload reduction that is discussed, and this is important. This is nowadays used. Beta blocker. These are the two beta blockers which are usually used in for to reduce the tachycardia. Selective beta blocker. Very important drug, and it is used now. Previously, the non-selective beta blocker, they usually give rise to bradycardia. So, propranolol, they can give rise to bradycardia, that can give rise to asthma, precipitation, etc. But these are very safe drugs, and they may be used. Now, defibrillator. So, if there is a intractable cardiac arrhythmia, নন্দন তোমরা তো বর্তমানে তো ইউজ করতে ডিফিব্রিলেটর, পিকুতে ইউজ করতে, ডিফিব্রিলেটর ইউজ there is no way defibrillator is used. So intractable cardiac arrhythmia, defibrillator is used. Cardiac resynchronization therapy. This is the current therapy. वो जेटा बोलेছিল left ventricular block. Left ventricular is not functioning and there is ventricular block. This therapy is used, resynchronization therapy. Mechanical circulation therapy, these are also used nowadays. Extracorporeal membrane oxygenation. করোনার সময় প্রচুর পেশেন্টকে ইউজ করা হয়েছে, ইসিএমও। ওকে, and heart transplantation. Cardiac transplantation is, so it is occurring also in case of, say, heart is not functioning at all, this cardiac transplantation is going on. And there is also report that in 1 year back, the other heart, like say bull's heart and others, that is transplanted in human being and the person is surviving. Problem heart transplantation, heart পাওয়া খুব মুশকিল, যেহেতু হার্ট ট্রান্সপ্লান্টেশন হচ্ছে, হ্যাঁ দিচ্ছে তো, দেওয়া হচ্ছে, ট্রান্সপ্লান্টেশন হচ্ছে, বুঝতে পারছো? So this is all about cardiac failure. তাহলে it's the time to ask questions, as there is 10 minutes more. Just go on. What is your opinion? Questions should be asked or not? এদের কি মতামত? যারা বলেনি তারা বলো, যারা বলেছো তাদের বলতে হবে। এদের দুজন বলে ফেলেছে, তোমাদের তিনজনের মধ্যে কে বলোনি? তুমি কিচ্ছু বলোনি? তুমি বলে তুমি বলেছো, তুমি বলোনি তো কিছু? তোমরা কেউ বলেছো? বলোনি এমন কেউ আছে? সবাই বলছে বলে দিয়েছে। ঠিক আছে, তোমরা আমাকে কোশ্চেন করো, আস্ক মি দ্য কোশ্চেনস অ্যাবাউট দিস। বল। হাইপোপারফিউশন মানে কি? ব্লাড কার্ডিয়াক পাচ্ছে না দিতে, তাই তো? মানে কন্ট্রাকশনটা হচ্ছে না, টিস্যুতে ভালো করে কন্ট্রাকশন করে ব্লাডটা, ফ্রেশ ব্লাডটা পাঠাতে পারছে না, ফ্রেশ ব্লাডটা পাঠাতে পারছে না, যেটা জমে আছে সেও ফিরতে পারছে না ভালো করে। হার্ট তো উইক। Pulmonary, there is pulmonary congestion and also systemic congestion. Heart failure means congestion both of pulmonary and systemic. So if the pulmonary congestion is there, less amount of blood is coming back to the left heart. বস না বস, তাহলে পারফিউশন কি হবে? কমে যাবে তো। তার মানে এখানে হাইপোপারফিউশন অ্যান্ড কনজেশন মিনস that the pulmonary heart is getting less amount of blood because of the severe congestion in the lungs and tissue. অলরেডি আছে সে কনজেশন পারছে না সেখানে, তখন ডিকনজেস্টিভ থেরাপি ওখানে ডাক অফ চয়েস, তখন ডায়াবেটিক্স থেরাপি, তাই না? ডায়াবেটিক থেরাপি ওখানে ডাক অফ চয়েস। বাট হোয়ার দ্যার ইজ হাইপোপারফিউশন যেখানে থাকবে সেখানে কী করবো? আফটারলোড রিডিউসিং এজেন্ট। সেই জন্য অত আর ডিফারেন্সিয়েট করা হয় না, বলা হয় যে তুমি দুটোই একসঙ্গে দিয়ে দাও, গিভ দ্য ডায়াবেটিক্স অ্যান্ড afterload reducing agent or captopril, okay, for compensatory management. তাই তো বন্ধুরা, দুটোই একসঙ্গে আমরা দিত, ওইটার জন্যই দেওয়া হয় যে আমরা এই ডিফারেন্সিয়েট করা খুব কনজেশন ডিফারেন্সিয়েট করা যায়, কারণ if there is congestion the feeling will be warm ট্রেন, সার্কুলেশন যেহেতু হচ্ছে গেছে যে ব্লাডটা, সেই জন্য ফিলিংসটা ওয়ার্মস হবে। বাট যদি হাইপোপারফিউশন অ্যান্ড ড্রাই মিনস হাইপোকনজেশন, সেখানে কিন্তু একদম কোল্ড কামি এক্সপেরিয়েন্স তো হবেই, এবং তার সঙ্গে তার ব্লাডও যাচ্ছে না, মানে বিরাট বিপজ্জনক অবস্থা, একদম শেষ হয়ে যাবে। থ্যাংক ইউ।